Coming up in just a couple of minutes, Julia Manchester is going to have an amazing panel dealing with an important issue of women's health. She had the chance earlier this week to have a conversation with Mark Cuban, who, of course, is well known for Shark Tank, his own company, and to talk about public health. So that is next, followed by our final panel. So again, direct yourself to the monitors.
Mark, thank you so much for joining us. You know, you were recently asked about a potential presidential run in 2028. You ruled it out, and I can't use your exact phrasing on that, but you said, no, I'd rather disrupt healthcare. You launched Cost Plus Drugs back in 2022. Since then, what have been some of your biggest wins and challenges?
Our wins have been considerable. We keep on growing. We keep on saving lives every day, every week. We get emails from patients saying, look, you know, I wasn't going to be able to afford my medication. I got one a couple of weeks ago from someone saying, I literally thought I would just die rather than saddling my family with the $900+ a month that I was going to have to pay. And you got it for me for $73 a month. So getting those, emails and hearing from patients on an ongoing basis and from doctors, that's a huge win. We started shipping from our robotics-driven factory in Dallas, Texas. So now we're making sterile injectables. We're making biosimilars. We can pretty much make anything there. We've been shipping, I guess it's been a year now. And so that's been a big win. We started Cost Plus Marketplace, just as insane as the drugs costs are for patients. The costs for clinics and hospitals are just as insane. I mean, it's like the whole entire pharmacy industry is a complete ripoff. So we started Cost Plus Marketplace for hospitals and clinics. And so we just keep on extending that and growing, and just trying to do what's best for patients.
Right, and you're entering the marketplace with a number of different competitors, Costco, Amazon Prime, for example. I guess in your view, what makes Cost Plus different? What makes it stand out?
I think what makes us different is, one, our transparency. The way we work, you go to costplusdrugs.com and you put in the name of the medication. We carry over 2,500. And so if we have it, the first thing you're going to see is our actual cost. Then you see what our markup is, which is always 15%. Then if it's mail order, there's a $5 shipping fee. There's $5 for the pharmacist to review the prescription. And that's it. It's simple and it's transparent. And I think people have come to trust us because we are so transparent.
You've touched on some of this already, but we know that obviously the cost of pharmaceutical drugs in this country are sky high. What does it take to make those specialty drugs more accessible to the consumer?
Very simple. Get the PBMs, the biggest PBMs in the country, to stop telling the major brand manufacturers that they'll take them off a formulary if you deal with costplusdrugs.com. It's that simple. I mean, if we were able to get access to brand medications for not even the same price as the big PBMs, but anything reasonable, when you add our 15% markup, our price is going to be dramatically lower, and you would see the cost of brand medications drop like a rock. But, when we talk to manufacturers and we say, look, why can't we get in the same rebate programs as these big PBMs? They tell us without telling us that, they don't want to lose their position on the formulary, which is, hundreds of millions or billions of dollars in sales. The big PBMs just won't let them deal with us. That is our problem, period, end of story. If we were able to get past that, I mean, we could save taxpayers billions. We could save patients tens of billions or more. That's the missing link.
So how do you get past PBMs? How do you jump over that hurdle? Is that something that's going to take time, that it will eventually come, or is that a long-term challenge?
So that's a good question. There's two elements. One, we'll always explore our legal options, but I'm not litigious at all. I really don't want to go down that path unless we absolutely have to. And two, I talk directly to self-insured employers. The CEOs of companies really don't understand how their health and pharmacy benefits work. It's not their core competency at all. And they don't realize that they are getting ripped off by these big PBMs that they're dealing with. That, I'll give you perfect examples of things that just make no sense in the deals that self-insured employers do. Most of them don't own their own claims data. Two, they can't talk to manufacturers at all. Three, they can't talk to each other. because the PBMs don't want any information about their contracts getting out at all. So they can't compare notes to get smarter. There's no transparency whatsoever in the contract level, in the pricing level. They don't even, they have these deals to get rebates back, and they actually don't know what their rebates are, and they can't audit them. They won't let you use an independent auditor. You have to use the auditor that they suggest. And then the biggest ripoff of all ripoffs, they have these things called specialty drugs. Often it's just, an injectable. It may be just a pill. Like there's a drug called imatinib. It's a cancer therapy. It's just a pill. And they put it on a specialty drug list and charge anywhere from hundreds to thousands of dollars versus our $21. Well, the CEOs of these companies don't realize that they're getting ripped off. So what we've been doing is going to them and working with what's called a pass-through PBM, Rightway, AffirmedRx, and others, and saying Vivio, and saying, look, work with these pass-through PBMs so you have access to all your data, all this information, all the costs, all the rebates are passed through so you actually truly get significant savings. And slowly but surely, we're having inroads. What's crazy is the biggest PBMs are now creating these products where they try to emulate us and replicate what we're doing, but they refuse to be transparent for obvious reasons. They don't want the CEOs of these companies to realize they're ripping people off. And let me add one more thing that's a big problem here. These CEOs are signing deals with these big PBMs, and as part of those deals for brand medications. So if you have a company and one of your employees or their families uses Eliquis, right? When it's time to go to the pharmacy and pick it up, that PBM that the company is working with won't even fully reimburse them for the full cost of that medication. And that's leading to thousands of independent pharmacies going out of business. And I don't think the CEOs realize, and it's not just CEOs, it's CMS, when they approve Medicare Advantage plans or Medicare Part D plans, they are approving these PBMs to under-reimburse independent pharmacies, putting independent pharmacies out of business and creating pharmacy and healthcare deserts. All these things add up. The problem was before we came along, there was nobody really working to educate CEOs in particular and CMS as well on the downstream impacts of all these things. And so we're working on it. And so directly answer your question, if we, with our pass-through PBMs, we cover about 22 million lives. If we can get up to 60 or 70 million lives, then I think that's a tilting point and the game changes. And then the manufacturers, rather than being threatened by the big PBMs, if they work with us, we'll be able to work with the same type of rebate programs, or better yet, net pricing, which is even more transparent and would actually make the pharmacies more money. The pharma manufacturers more money.
I'm going to ask a bit of a layman's question when it comes to the independent pharmacies. I rarely see an independent pharmacy. It's normally the big pharmaceutical chains where, so many of us often get our prescriptions. What is, your company's relationship with these independent pharmacies? Is there a direct line between these two? Are you looking to, grow more there?
Yeah. We have a pharmacy network called teamcubancard.com. And so if you want any of the products that we offer from Cost Plus Drugs, but you'd prefer to pick it up locally, we partner with about 17,000 pharmacies right now. Right now you have to go to teamcubancard.com to go through that process, but we're in the process of updating costplusdrugs.com to integrate the two. So to answer your question, yes, we partner with them. And what we do that's dramatically different than what the big PBMs do is when you take a prescription through Team Cuban Card to your local pharmacy, could be just the independent guy that your family's been going to for 25 years. We will pay them a $12 fill fee so that we're actually paying them for their time, and they're getting not only fully reimbursed, but they're actually making a profit on the sale of the medications as well. I want independent pharmacies to stay in business. The manufacturers want independent pharmacies to stay in business. There have been CEO, or at least one CEO of a major PBM company that said it's not his job to keep them in business. He doesn't care. I do care. I want independent pharmacies to stay in business. I think as a country, we don't want to see pharmacy deserts. We need them to stay in business. All those people, senior citizens that have been going to the same pharmacist for decades, and that pharmacist knows them, they know their family. That's important. That saves lives. And so we want them to succeed. Again, the problem is that the biggest PBMs won't fully reimburse. And the second order of that problem is literally CEOs are signing deals that under reimburse those pharmacies. CMS, HHS, the government is approving Medicare Advantage plans where they under reimburse those independent pharmacies. It's horrific. And so, hopefully all this changes. And actually, I have some high hopes for this administration to take action there.
Have you had any conversations with Secretary Kennedy or anyone from the Trump administration on this?
I can't speak to Mr. Kennedy and exactly what he's going to do, but in actually secondhand conversations, because I think I've tried to have some conversations with the administration and HHS, and I've gotten some resistance to talking to me, but going through intermediaries, the feedback I've gotten is they realize this is the problem. I got a DM today, actually, where they talked about a variety of things that will benefit independent pharmacies and patients and hopefully cut the cost of Medicare if they're able to do it, which would open the door for costplusdrugs.com to work at just a 15% markup or lower with CMS. So we'll see what happens there. But I'm hopeful.
I'm curious. You mentioned you haven't talked directly with Mr. Kennedy or the administration, but we've chatted with Republicans who have very strong views about PBMs and getting them, in their words, under control. Have you had those conversations with Republicans?
Not since January 20th, no. I got the word that they're kind of afraid to be seen with me. That particularly Doge was afraid to work with us. But that was just from one person. Who knows how deep that goes? But I know in the past, prior to January 20th, I have talked to a variety of people. And I take that back. I did hear from the staff of one senator last week, and we exchanged ideas on how we can improve the market. And really, it just comes down to one thing: to save taxpayers and patients tens of billions of dollars, if not more. The minute Big Pharma will allow us to participate in the rebate programs, we don't need the same rebates as the big PBMs. If they get an 80% rebate, if we get a 60% rebate, when we add our 15% margin, we will cut the cost of brand medications so dramatically, we'll have the same impact that we've had on specialty generics, which is to just the prices have just dropped like a rock, and people have saved, we don't even know how much money. So if we're able to participate in these rebate programs at anything even reasonably close to what's happening now, and then just do our normal cost plus 15%, the cost of medications to taxpayers, to patients, it'll just, because we'll be transparent about it. If it's Eliquis and we're getting a 60% rebate, whatever our net cost is, plus 15%, we're going to show it and we're going to explain it to you. That's not being done right now. Literally, as crazy as it sounds, we are the only company that publishes their entire price list. So costplusdrugs.com, we'll send you our entire price list. And by the way, when the FTC examined the PBMs, they were using our data. They used our markups. They used our pricing. And when you're seeing these ERISA lawsuits where they're going at companies and saying, look, you're not living up to your fiduciary responsibility because you're not getting the best prices for medications and for care, but for medications, when those lawsuits have been filed and you dig into them or talk to them, they're telling us, we're using your pricing because you are the only price list available. So if we're able to get over this hurdle of not having rebates available to us, the amount of money that we can save taxpayers and patients will be, to paraphrase something, like you've never seen before, the most in history ever.
I want to shift a little towards politics. One big topic of conversation here in Washington is this House Republican drafted government funding bill. And, speaking of healthcare, Democrats have attacked those House Republicans for essentially, voting for what they said is a vote to defund Medicaid. House Republicans, President Trump pushed back against that, saying they do not want to defund Medicaid. I'm curious to get your thoughts on that bill and whether, how concerned you are about potential cuts to Medicaid and Social Security if this actually happens. Again, House Republicans very much pushing back on this, but wanted to get your take.
Yeah, I haven't read the bill. I mean, it's enormous apparently.
Yes.
But I don't, I think the way I look at it as an outsider, certainly not an insider, is they're just trying to move Medicaid from the federal government to states. And so I don't think the challenge is how much money they're spending. The challenge is whether the states can handle all the additional responsibility. And, states already handle Medicaid, but, it's hard to know exactly what happens when you push all this more to them. So I just don't know enough. And it's kind of the same with Social Security. I've read on one hand that they've closed a bunch of offices. Then I read somewhere else that they were just one-person offices. And then you read elsewhere that for anybody who needs to change their direct deposit or bank account information, you can no longer make a phone call. And so if there's offices closed and you can no longer make a phone call, you might be a senior citizen that just wants to, maybe was getting too high of fees at their bank and wants to switch to a low-fee bank. And they're not online and they don't have a local Social Security Administration office, that could create problems. And I think that's the challenge. So
you would say you could potentially be open to seeing some of these programs shift to the states, but there are some concerns for you there.
Well, the devil's in the details. There's some states that have done a great job dealing with Medicaid, and maybe more money from the feds might allow them to do a better job. There's others who have not expanded Medicaid, and it's been a struggle for a lot of uninsured people in those states. So it really depends on how each state handles it.
You've ruled out running for president. Would you rule out a run for higher office, whether that's a governor's race or a Senate or House race?
Yeah, no interest.
No interest.
No interest at all.
Got it.
Well, if I can get over this one hurdle on rebates for cost plus drugs, and then we're starting to work on the healthcare side, not just pharmacy, with some transparency things we're doing there. I mean, when it's all said and done, if I could change healthcare in this country, that would be amazing. I'm not saying I'm going to be able to pull it off, but I know we've had a significant impact with costplusdrugs.com. And I think getting there and focusing on that and just changing people's lives for the better on the healthcare side of things, that's my mission.
Mark Cuban, thank you so much for joining us today.
Thanks for having me.